According to the National Institute of Mental Health, almost 18% of adult population experience some degree of mental illness, and about 4% suffer from serious mental health problems. Fortunately, as we learn more about the brain, newer drug therapies can reduce some of the suffering associated with living with mental illness. As you learned in Chapter 10, chemical neurotransmitters have important roles in transmitting messages between the brain and other areas of the nervous system. Neurotransmitters are involved in memory, storage and recall of information, mood, emotional state, and affect response to a specific stimulus or event. And learning how these drugs work will help you understand their impact. The main neurotransmitters affected by psychiatric drugs are serotonin, dopamine, norepinephrine, GABA, aminobutyric acid, known as GABA, acetylcholine, and histamine. These neurotransmitters and how they typically affect mental health and mental illness. This chapter focuses on drugs that are used for sleep difficulties, anxiety, depression, and other mood disorders, including psychosis. Some examples of neurotransmitters and their functions: norepinephrine from the sympathetic nervous system, the fight or flight response, provides the alertness and arousal. The possible changes in mental health and illness is that it decreases in depression. Serotonin is responsible for the sleep, the appetite, the pain, and the mood. It's decreased in depression. Dopamine, learning, movement, motivation, and drive, attention, pleasure, and reward. It's increased in schizophrenia. The GABA, inhibitory neurotransmitter, responsible for sleep, muscle tension, sedation, decreased in anxiety. Acetylcholine, the parasympathetic nervous system, responsible for the rest or repose, is decreased in Alzheimer's disease. The histamine is responsible for the sleep-wake cycle, the memory, the learning, the pain, and the reward. It's increased during stress. Sedative and hypnotics. Sleep is a state of rest for the mind and body in which conscious awareness is reduced partially and completely. Sufficient amounts of sleep are needed daily to restore energy levels and promote optimal mental and physical functioning. Adults vary in how much sleep they need daily and whether it must occur over 6 to 8 hours or can occur over multiple shorter periods throughout the day. Most adults have experienced occasions when they could not get to sleep or did not remain asleep during the expected period. This problem is known as insomnia. Many people have occasional insomnia, but others struggle with this problem almost daily. When sleep is insufficient for adequate rest, all aspects of functioning are affected. Areas of obvious impairment include learning, remembering, concentration, judgment, reaction time, coordination, and general social interactions. You probably have been around someone who is sleep deprived or have had this problem yourself. People who suffer from sleep deprivation may feel irritable, impatient, and unable to concentrate. People who have chronic insomnia usually require a more complex behavioral or pharmacological approach to help the problem. For those who have intermittent problems with insomnia, drug therapy can be helpful. A sedative is a drug that promotes sleep by changing signals in the central nervous system, the CNS, and reducing responses to stimulation. A lower dose sedatives have a calming, relaxing effect, and at higher doses, they cause sleep. Drugs in this class that are used mainly to cause sleep are called hypnotics. Sometimes people may use or be prescribed a drug that has a side effect of sedation, such as an antihistamine or muscle relaxant, but this discussion focuses only on sedatives. The class is sedative hypnotics, benzodiazepines. The action is inducing and prolong sleep or reduce anxiety by binding to benzodiazepine receptors to enhance the inhibitory effects of GABA and make the CNS less responsive to stimuli. Estozolam, flurazepam, temazepam, known as Restoril, Schedule 4, and lorazepam, Ativan, Schedule 4. The two main categories of drugs prescribed for sleep are the benzodiazepines and benzodiazepine agonists, also called non-benzodiazepines. Benzodiazepines are a class of sedative hypnotic drugs that depress the CNS by binding to benzodiazepine receptors, which then act with GABA receptors to enhance GABA effects. Depending on the drug dose and concentration, they reduce anxiety, induce sleep, and relax skeletal muscle. Sleep begins sooner after going to bed, and total sleep time is increased. If you recall from an earlier chapter that GABA is an inhibitory neurotransmitter, and when GABA receptors are stimulated, CNS activity is reduced. Depending on which type of benzodiazepine receptor a specific benzodiazepine binds to. Other responses can include reduced seizure activity and reduce anxiety. Depending on dose, drug concentration, and added chemicals, some benzodiazepines are approved for use as sedatives but are not to relieve anxiety. Others are approved to reduce anxiety but are not approved for sedation. So the nursing implications with sedative hypnotics are to teach the patients not to take sedatives with alcohol or other CNS depressants to avoid severe CNS depression, such as coma or death. Ask women if they are pregnant because these drugs have a high risk of causing birth defects. Tell patients not to drive, operate dangerous equipment, or make serious decisions while under the influence of these drugs because impairment of judgment and memory are possible. Tell patients to take the drug only if they have sufficient sleep time available to prevent confusion and other effects while awake. Another class, benzodiazepine agonists. This classification has different chemical structure from the benzodiazepines, but still binds strongly to benzodiazepine receptors. It acts in the same way as benzodiazepines to initiate sleep and promote longer sleep with less risk for drug dependence. These drugs are used more specifically for sedative effects and have less muscle relaxing or anti-seizure action than benzodiazepines do. Benzodiazepines most commonly used to reduce anxiety. Check with the drug reference guide or a pharmacist for information about other sedative hypnotic drugs. The assessment is to ask the patient about all other drugs he or she is taking, including anything that is over the counter, to determine whether there are other drugs that depress the CNS. Assess the patient's level of consciousness and ask whether he or she has a history of depression, confusion, falls, or pain. Ask about the patient's use of alcohol, because these drugs should not be taken with any type of alcoholic beverages. Ask women of childbearing age whether they may be pregnant. These drugs should not be used during pregnancy. Examples of these drugs are eslopicolone, Lunesta, and zolpidem, Ambien. The nursing implications for benzoagonists: make sure the patient understands that they need at least 7 to 8 hours of planned sleep time available when taking this drug. Suggest that the patient also have a family member or close friend available for the first time that they're taking the drug, because there may be an instance of sleepwalking or sleep eating or sleep driving, which have been reported to have occurred. Make sure the patients understand not to drive or operate dangerous equipment or machinery, or make serious decisions while under the influence of these drugs, because of the impairment of judgment and memory are possible. Patients need to understand that these drugs may create a metallic taste in the mouth, and sedatives such as these should not be mixed with alcohol or any other CNS depressants to prevent or avoid further severe CNS depression that would result into coma or death. Make sure the patient understands that they need sufficient amount of time to sleep to prevent confusion or other daytime effects. Make sure the patient reports any agitation to their healthcare provider or any other residue of side effects. Monitor the patient's level of consciousness carefully, because higher doses can lead to greater risk of daytime memory impairment and decreased alertness. These drugs really should not be taken for longer than 2 to 3 weeks, and only when needed to avoid physical or psychological dependency. The drugs for sleep, only if you have at least 5 to 6 hours immediately available for sleep, to avoid excessive drowsiness when you are supposed to be awake. The patient has to understand the importance of not mixing these drugs with alcohol. And drinking excessive amounts of caffeinated beverages can reduce the effectiveness of this drug as well. The expected side effects and adverse reactions: both classes of sedatives can cause mild daytime drowsiness and some memory loss. Both are metabolized by the liver and should not be used by anyone who has a liver disorder or impairment. The benzodiazepines have a higher risk of addiction and dependency than do benzodiazepine agonists. They also carry a black box warning for CNS depression. Overdoses are possible and serious. These drugs have a high risk of birth defects. Benzodiazepine agonists might induce physical activity during sleep for some people. These activities have induced sleepwalking, sleep eating, and even sleep driving, all without the person's awareness or remembrance of the action. The drug interactions: caffeine reduces the effectiveness of sedative drugs from both classes. The benzodiazepines interact with any drug that causes CNS depression and can make the depression deeper, which can lead to death. Drugs known to increase the action of the benzodiazepines and the benzodiazepine agonists include cimetidine, fluoroquinolone, antibiotics, and some oral contraceptives, and many others. Always consult a drug reference or a pharmacist to avoid possible drug interactions. The evaluation and expected outcomes. Usually sedatives begin to take effect in 15 to 30 minutes. Check the patient without waking them at the time for drug effectiveness and for changes in respiratory rate and depth. If this is the patient's first time taking the sedative, recheck at least hourly, about 4 hours, and assess for any unusual reactions, especially sleepwalking or other activity. The expected outcome is that this drug would promote sleep or a restful state, that there would be improved sleep maintenance. The patient would awake in the morning and have a restful night's sleep and have a better functioning ability the next day. We can all identify with feelings of anxiety at certain times in our lives. We may describe it in terms of feelings of unease, worry, or apprehension. When we are anxious, we may experience physical and behavioral symptoms. Perhaps our heart rate increases and we may have a mild headache or breathe a little more rapidly. In some cases, we may find ourselves being a little more irritable, pacing, or our muscles feel tense. These are all symptoms of anxiety. Anxiety is very common, particularly in some times of increased stress. Anxiety can be mild, moderate, or severe, depending on the situation. A person who has chronic or disabling anxiety may be experiencing an anxiety disorder. Advanced practice nurses or healthcare providers may diagnose, for example, general anxiety disorder, social anxiety disorder, panic disorder, obsessive compulsive disorder, or post-traumatic stress disorder. Although a detailed discussion of each of these disorders is beyond the scope of the textbook, many can be well managed with a combination of non-pharmacological strategies, including counseling and pharmacological therapy. Any drug that can reduce anxiety may be described as an anxiolytic. Major categories of anti-anxiety agents are benzodiazepines, benzodiazepine agonists, and certain antidepressants. Selective serotonin reuptake inhibitors, known as SSRIs, and serotonin norepinephrine reuptake inhibitors, known as SNRIs. In general, the choice of drug varies according to the needs of the patient, including whether the anxiety is an acute or chronic condition. A class known as Anxiolytics, also known as anti-anxiety, otherwise known as benzodiazepines. Their action, they intensify the effects of GABA transmitters in the brain to allow more GABA to reach the receptors in the brain to trigger the actions needed to suppress abnormal electrical activity. Examples of these drugs are alprazolam, known as Xanax, Schedule 4, diazepam, known as Valium, Schedule 4, lorazepam, known as Ativan, Schedule 4. If you recall from the earlier chapter that GABA is an inhibitory neurotransmitter, and when GABA receptors are stimulated, CNS activity is reduced. Depending on which type of benzodiazepine receptor a specific benzodiazepine binds to, other responses can include reduced seizure activity and reduced anxiety. Depending on dose, drug concentration, and added chemicals, some benzodiazepines are approved for use as sedatives, but not to relieve anxiety. Others are approved to reduce anxiety, but are not approved for sedation. The benzodiazepine and benzodiazepine agonist classes of drugs for sedation can also be used as anxiolytics. These drugs act with GABA receptors to enhance GABA effects. which reduces anxiety and decreases muscle tension. Benzodiazepines are recommended primarily for short-term use, such as during a panic attack, during alcohol withdrawal, and before surgery. They generally should not be prescribed on a PRN basis because irregular use can increase anxiety due to variations in blood drug levels. Long-term use of benzodiazepines can result in physical dependence and withdrawal symptoms if the drug is stopped suddenly. A newer drug from the benzodiazepine agonist class, buspirone, reduces anxiety through a variety of actions that affect the serotonin and dopamine neurotransmitters. Onset of the anxiolytic effect is slower with the benzodiazepine and may take 1 to 2 weeks. Maximal effects of buspirone may take up to 3 to 6 weeks. This drug can reduce anxiety without the risk of physical dependence and the sedation that is often associated with benzodiazepine drugs. Certain drugs that are often considered antidepressants, such as SSRIs and SNRIs, are commonly used to relieve symptoms of anxiety. Now, the drug that it was talking about, this buspirone, it's referring to Buspar. The nursing implications. These drugs may cause drowsiness and advise patients to avoid driving or operating heavy machinery or making any important decisions while taking these drugs. Provide patients with a call light and remind them to ask for help if getting out of bed, because these drugs can cause dizziness and drowsiness. Patients who are taking these drugs should be assessed using your agency's fall risk protocols because these drugs increase the risk of falls. These drugs are intended for short-term use because they can cause physical dependence. Notify the healthcare provider. If you have a patient admitted to your facility who has been using these drugs for more than 2 to 4 weeks. Teach patients who have been taking benzodiazepines for more than 2 to 3 weeks not to stop them suddenly to avoid physical withdrawal symptoms. If they need to discontinue, they may require gradual and individualized tapering. Benzodiazepines should not be used in older adults because they increase the risk of falls and mortality rates. Assess your patients for a history of alcohol or other substance use disorders because they are at increased risk for benzodiazepine dependence. Teach patients to avoid using nicotine products such as cigarettes and chewing tobacco, or drinking caffeinated beverages such as coffee, tea, and cola, because they can decrease the effect of anxiolytic drugs. Teaching the patients to avoid driving or operating machinery until they are certain that buspirone does not cause them to feel sleepy or dizzy. They're talking about the Buspar as well again. Tell patients that the drug may be taken with or without food, but should be taken the same way each time to avoid inconsistency in the dosage. Remind patients to avoid eating grapefruit or drinking grapefruit juice while taking buspirone because it can increase the effect of the drug. The nursing implications for benzodiazepines is to teach patients not to take sedatives with alcohol or any other CNS depressants and to avoid severe CNS depression, coma, or death. Ask women if they are pregnant because these drugs have a high risk of causing birth defects. Tell patients not to drive or operate dangerous equipment or make serious decisions while under the influence of these drugs because impairment of judgment and memory are possible. Tell patients to take the drug only if they have sufficient sleep time available to help prevent confusion or other effects while awake. The nursing implications to benzodiazepines is to teach the patients to take the sedatives if they have sufficient amount of sleep available to them, so that it helps to prevent having confusion during the waking hours. Not to take these sedatives with alcohol or with any other CNS depressants to avoid severe CNS depression, coma, or death. To ask women if they're pregnant, and to warn that these are high risk for causing birth defects. To tell patients not to operate dangerous equipment or machinery, or to make decisions because of the high risk of impaired judgment or memory that are potential. To take this drug exactly as it's prescribed. Withdrawal symptoms can occur if the drug has been used for longer than 2 to 4 weeks. In that case, encourage the patient to contact the healthcare provider. There will need to be a tapering dose. Do not use this drug with grapefruit juice, because this drug could cause an increased effect if it is consumed with grapefruit juice. Patient may have orthostatic hypotension when changing positions, so change positions slowly. And do not use nicotine products such as cigarettes and chewing tobacco or different caffeinated beverages, because they decrease the effect of the anxiolytic drugs. The nursing implications and patient teaching. Check the patient's vital signs, including the blood pressure and the pulse, the heart rate, and the respiratory rate before giving the drug. Patients with a history of lung, liver, or kidney problems may be more sensitive to the effects of the drug. Assess the mental status of the patient before giving the drug. If he or she is oriented to time and place and person. If not, contact the healthcare provider before giving the drug. Assess the patient for a history of alcohol or other chemical dependency, because there is an increased risk of benzodiazepine dependency. This is less likely with the benzodiazepine agonist. Ask patients to describe their feelings of anxiety to determine the effectiveness after you have given the benzodiazepine drug. The planning and implementation. Many benzodiazepines have a rapid onset and short duration of action, requiring multiple doses per day. They can be used very effectively for patients with acute anxiety or panic attacks. Buspirone, a benzoagonist, and other antidepressants used for anxiety have a much longer onset of action, and it may take several weeks for the patient to notice an effect. Monitor the patient for side effects of drowsiness or dizziness, because these can cause an increased risk of falls. Report changes in mental status, such as confusion or agitation, to the registered nurse or healthcare provider. If patients have respiratory depression after benzodiazepine use, flumizeril, a benzodiazepine receptor antagonist, can quickly reverse the effects. For long-term mental health, non-pharmacological therapies such as counseling, mindfulness training, yoga, and other interventions are essential. Provide the patient and family with information about local resources, including crisis lines, support groups, and websites such as the National Association on Mental Illness. The expected side effects and adverse reactions of anxiolytics are very similar to those presented in the section on drugs used for sleep. Benzodiazepines and benzodiazepine agonists may cause some drowsiness and memory loss when used for anxiety. Other side effects include dizziness, headache, and hypotension. Adverse effects include confusion, apnea, and seizures. In addition, it is important to remember that benzodiazepines have a higher risk of addiction and dependency than the benzodiazepine agonist. The drug interactions: do not give benzodiazepines to patients who are taking sodium oxybate, a drug prescribed for narcolepsy, a sleep-wake disorder. This combination can result in serious respiratory depression, even coma. Avoid giving benzodiazepines to patients who are taking opioids or other drugs that can result in CNS depression. Do not give buspirone with monoamine oxidase inhibitors, MAOIs, opioids, or drugs for tuberculosis. Drinking grapefruit juice can significantly increase the blood levels of buspirone, which increases the risk of adverse reactions. And benzodiazepines are not recommended to treat insomnia, agitation, or delirium in patients that are 65 years of age or older, and they are avoided in all patients with cognitive impairment of dementia or a history of falls or fractures. The evaluation expected outcome. Ask the patient whether he or she has experienced any relief from anxiety and explore how the drug affects the patient's ability to focus, make decisions, and function. If the patient is still having symptoms, contact the healthcare provider for the next steps. If the patient has been using benzodiazepines for longer than 2 to 4 weeks, suddenly stopping the drug will result in severe withdrawal symptoms, including panic attack, vomiting, sweating, abdominal, and muscle cramps. Could even result in seizure activity. The risk of seizures is greatest during the first 24 to 72 hours after starting to withdraw the drug. Slow tapering of the drug dosage can decrease the risk of withdrawal symptoms.